Good morning. Welcome to Arthritis Broadcast News. I'm Marilyn Muldoon. We're here at the Arthritis Alliance headquarters, and I am with the Consumer Advisory Board, the Patient Advisory Board now at the Arthritis Research Center in Vancouver. Yesterday, I had the distinct honor of attending Dr. Brian Feldman's talk on measuring stuff. What's right, what's wrong? Brian is a senior scientist, and head of the rheumatology department at the Toronto Hospital for Sick Children, and a numerous award winner, and this year's recipient of the Distinguished Investigator Award at the CRA here in Mesauring, British Columbia. Brian, thank you for coming. Your topic, measuring stuff, what's right, what's wrong. You then had your secondary caption, we can't measure what we don't measure. How does that mean? We can't manage what we don't measure. So why is it important to measure? What should we be measuring?
When dealing with patients and how patients respond to therapy and what their goals and values are, it's very easy for us to get caught up in traps of thinking that scientists call cognitive bias, where we sometimes see what we want to see. So if I were to start a patient, a child with arthritis on a medication, I want them to get better, and I might fool myself, if you like, into seeing that they're getting better when they really haven't. And so there's a real importance for objective and reliable measurements to allow us to really know whether the treatments we're using cause more good than harm, whether the diagnostic tests that we're using lead to benefit, and so on.
The sort of techniques we're using to test those outcomes have changed dramatically, haven't they, over the last little while? For example, I noticed when you were talking about the kids at the hospital, you're saying they're little whiz bangs with the tablets. How are kids responding to treatment as well as outcome measures, whether it be their own interpretation or to your guidelines? Has that changed dramatically?
The use of technology hasn't fundamentally changed the way that we approach patients or the way that they move through things, but I think it has been quite engaging for some families. We had a lot of discussion yesterday about, and the day before, about social media and how social media can be used.
I was going to ask you, yes?
One of the things that had come up yesterday was the difference between the importance of measuring the subjective well-being, which is ultimately what we want to influence, and at the same time not creating false expectations or unrealistic expectations for patients about treatment. Oftentimes, the rheumatologist, this was pointed out yesterday, has a better feeling, better understanding of what's going to happen in the future than patients themselves. And maybe by making communities of patients, the way we've been doing now through email, but perhaps harnessing some of the newer technologies and newer social media, would allow us to create stronger education strategies and allow people to manage their expectations in a much better way with the influence of others who've been there and done that. The way that children approach the world has changed dramatically with the advent of newer technologies, and the attention span has changed, and the way kids interact has changed. The fundamental nature of the kind of patient-doctor relationship, I don't think has really changed. We're just adapting to new ways of doing things.
And do you see it changing, the patient-doctor relationship? I know we here in BC, we're trying to get a more team approach to things rather than patient-doctor. Is that working in Ontario as well?
So the fundamental contract between a patient and a physician, or patient and a healthcare worker, I don't think will change. I think the healthcare team, all members of the healthcare team, are really into it in order to provide their best advice and provide the best options for management so that patients will get better. However, the way we provide that care is undoubtedly going to change. The models of care we use are going to change. So we've just started something in Ontario. We only have in Ontario a handful of rheumatologists that look after children. It's a very big province. The children come from all over the province. Many of them have to travel a day to see a rheumatologist. And yet we've, in Ontario, been very fortunate that a number of therapists, occupational therapists, physiotherapists have been trained in something called the ACPAC program to be extended practice providers. And they're scattered all over the province, much closer to where the patients live. And working with telemedicine technology, we're establishing links between the local communities and the extended practice therapists that work there with the clinics in Toronto and London and Ottawa, Hamilton, where the pediatric rheumatologists live, so that the patients don't have to travel so far, but they can still get excellent care.
Right. The strengths and weaknesses in rheumatology when measuring, for example, disease activity, recovery rate, effectiveness of meds, etc. Can you address that for us? We're just wondering, with the measurements, what are the strengths and weaknesses of them?
So we've been incredibly fortunate in rheumatology to be at the vanguard with world leaders in developing these measurement tools.
Right.
And so we're far ahead of almost any other medical field. But at the same time, all of the tools that we use, imaging tools, physical therapy tools, biomarkers, questionnaires, the various different things that we use to measure disease states, have been developed primarily by clinicians and not necessarily using the most sophisticated means possible. And so even though we're at the forefront, we've been incredibly fortunate to be there, there are things that we can improve, and that's what I was talking about yesterday. And there's probably an untold number of ways we can improve as we start to borrow expertise from people in other fields that have experience in measuring things in other ways. But the ones that I focused on yesterday had to do with really just upping the game just a little bit in terms of how we think about things to give us more sensitive and better measures.
Absolutely. You mentioned 2 books yesterday that you thought were interesting to read. Would those be of interest to the lay folks that are watching us today?
Yeah, both the books that I talked about were New York Times bestsellers, written by scientists but for the lay public.
Okay.
And I think both make outstanding reads.
Would you like to share the titles with us?
Yeah, so the first was Daniel Kahneman's Thinking Fast and Slow. And the second was a book called The Wisdom of Crowds.
I'm going to have to find those and read them right away. But this conference we're having here in Whistler right now, I know we're not finished all of the seminars and whatnot. So far, is there anything that you're going to be taking back, something new, something exciting that you've come across here? Is there something that you've noted that is important, that is being stressed here at the conference?
There's been a lot of exciting discussion, exciting talks about various different controversies in medical practice, different alternative ways of looking at things, and different models of care, all of which are really stimulating and part of our ongoing discussions in rheumatology. But I think the biggest value of a meeting like this is the interpersonal connections that we make, not just for looking at patients, but also for establishing and coming up with new research projects, new avenues of inquiry, new ways of teaching our junior trainees, new ways of reaching out to patients and patient groups. And that doesn't happen when you're sitting in your office by yourself. That happens when you mix together with a lot of other people.
Exactly. And one of the things that I find exciting to have been invited to sit with the Patient Advisory Board at the Arthritis Research Center is just that. Having the patient input into the research. Sometimes the researchers will come to us and say, we have this idea, what do you think? What do you think? Well, actually, that sounds like a brilliant idea, but it's really not going to help us very much. In practical terms, it's not going to help us very much. But that said, as a Patient Advisory Board, is there anything that we could be doing that you can think of to help you personally or to help rheumatologists in general? Is there anything that you think we could be doing to help move forward the research and practical application of
the potential influence of patients and patient groups is limitless. There's been a movement over the last, in my experience, about 15 years of trying to get patients and patient advocates involved in planning and disseminating research and research findings, things that you just mentioned. But I think the scope for advocacy to make lives for patients themselves and future patients much better is huge. I work a lot with the Arthritis Society, and to try and lobby governments, companies, industry, as a physician, or as a group with a strong vested interest, doesn't have nearly the same impact as patients coming forward demanding things that are important for themselves.
I agree. And given that we have the social media now, we have Facebook and Twitter and whatnot, I think the time has come that we are in an excellent position to have the patient voice stand up and be heard. I know
So right.
Absolutely. Now tell me, with all of these degrees, with all of these lectures and things you're doing, and all the research, what does a gentleman like you do to unwind and enjoy himself?
I think many of the people at this meeting, many of the physicians and allied health professionals probably work very hard, but then also probably play pretty hard too.
Really?
So, like personally, I've just started a new sport. I'm learning how to do reining horse competition.
Oh, really?
Yeah.
Yes.
Just bought a horse.
So you're going to be doing barrels and cutting and the reining and whatnot. Are you going to go for the whole package eventually?
Right now, I'm just trying to learn how to ride. We'll see where it goes.
So, well, no doubt then with the reining, you're going to be doing Western saddle.
Yeah, sure.
Excellent. Have you ever tried English?
That's only on trail.
That's a whole new exercise in contortionism. And for people like myself, started off riding, going English with the increase in arthritis and whatnot, suddenly the Western saddle is looking really, really comfortable. Well, I wish you all the best of luck with your reining, and don't break any arms or hurt yourself so we lose you for any length of time to injury and repair. Thanks so much for stopping by. I really appreciate it. Thank you.